Hello, I'm Erica Jeffrey. My number is 1014318. I'm going to be showing you a video for lab here on giving a oral medication, sublingual or buccal. We're going to be using a sublingual. By doing so, the first thing I would do is I would be getting a doctor's orders and I would be comparing them, okay? Checking if they're transcribed properly. I'm going to see here electrodenally. She's going to need an Ativan. Okay, 1 milligram. Okay, at this date. Okay, and the time, and everything matches up. You don't want to have any med errors, so we're always going to perform the 10 writes and 3 checks. So I'm checking that here now. That's the first one. And I'm going to be doing the second check as well when I am getting the medication. So I'm going to have a tray. I'm going to be using this. I'm going to be putting 1 Ativan, 1 milligram into a cup here for her. I'm going to also label it as well, putting her name, the medication, and my initials so I know where it came from and where it's going. Get that ready, and I'm also checking the MAR and the doctor's orders as well, making sure that this is the right medication I am going to be giving to her, checking the right drug, the right patient, right dose, the right route. So it's going to be sublingual, which will be underneath the tongue. The time that I'm going to be giving it to her, how often I'm giving it to her, so the frequency. Checking the documentation. I am also checking her history as well, whatever information I have on hand. I'm also, now what I'm going to be doing is I'm going to go and see my patient. Before doing so, I'm going to be practicing hand hygiene, and I'm going to gather up my materials, and I'm going to go and see Electra here, who's given us permission to have her in the video. So I'm going to be coming into the room. Always make sure if there's no door to protect your privacy with a curtain. And be like, hello, how are you doing today?
I'm good, thank you. How are you?
I'm good. My name's Erica. I'm going to be your nurse.
Okay.
I'm just going to check your wristband here. Can you tell me your name, please?
Electra Delaney,
And your date of birth?
June 18th, 1990.
Awesome, thank you. And then that turned out to be correct. I'm also going to check her vitals as well because we want to make sure that she's in good standing for the medication. I'm going to be checking her temperature, her pulse, her respiratory, her oxygen level, her blood pressure, as well as asking her, how is your pain?
It hurts.
Okay.
About 7.
And where is the pain?
In my chest.
And what does it feel like?
Closing.
Is it tight?
Tight.
Okay. And that's why we're giving her the Ativan, because she's having tightness with her anxiety. I'm letting you know. I was like, we're going to be giving you this medication, okay?
Okay.
It's going to go underneath your tongue.
Okay.
It's going to help relax you. If it can cause drowsiness and some muscle weakening. And you're okay to take this here? And do you have any allergies?
No.
No. And again, I'm doing my third check as well. I'm checking medication, the patient, I'm checking my MAR, and I'm going to be giving it to her. And I'm going to be, here you go.
Thank you.
Okay, and you're going to go underneath your tongue.
Okay.
Okay, and just let that dissolve there. It's going to go through your bloodstream a little bit differently than you would if you were taking any other medication, so it's going to hit you a little bit faster.
Okay.
Okay, and after that is done, I'm going to ask her too, because sometimes they do taste kind of funny, so I'm going to ask her, do you want a drink of water or anything?
Yes, please.
Here we go. Thank you. You're welcome. And she's already sitting in the supine position, like a proper position for taking this medication. She's not just laying down on her back or anything, so that was good. If so, I would make sure the patient was getting into the right position. And ask if you have any questions, if you need anything else.
Nope, I'm good.
No, okay, and you have your cowbell here, and I will be coming back to check on you in a few minutes, about 15 to 30 minutes, okay?
Okay.
All right, and then I'm going to dispose of any materials I would have on hand if I was wearing gloves as well, and the tray. Dispose of that. I'm also going to document now the initial the MAR. I wouldn't do so beforehand until after I gave her the medication. And I'm going to evaluate on her. Like I said, I told her I'll be back in the 15 to 30 minutes because that's normally how long it would take for the medication to take effect. and we'll check her vitals again as well. And that is everything for our first video here, and I'll see you in the second one. Thank you.